Good morning, everyone. Good morning. My name is Ambassa Chokmo, and today we're going to talk about the impact of telemedicine on the clinical management of the diseases. So, my project, as I said, is focused on telemedicine. So, let's just go ahead and start with the introduction. So, what is telemedicine? What does it do? How does it work? So, the intersection of telemedicine and in clinical disease management has become a focal point on attention in recent years, particularly in the context of the global COVID-19 pandemic. So, telemedicine utilizes innovative telecommunication technologies to extend healthcare services to patients at a distance. So, paving the way for potential shifts in patient access to medical care. So, this service endeavor to delve into the multifaceted impact of telemedicine on disease management practices and its ability to enrich the overall patient care experience. So, purpose. The purpose is to explore the effect of telemedicine on clinical disease management. So, with a specific focus on evaluating the experiences, challenges, and outcomes perceived by both patients and the healthcare providers. So, background. Recent scholarly works such as Rose and Rokiki have shed light on the diverse effects of telemedicine on healthcare delivery. So, Rose exploration into the telehealth experiences of young individual in Aotearoa, New Zealand. I don't know how to pronounce that. And Rokiki study on women dealing with perinatal depression amidst the pandemic underscore the significance of incorporating patient perspectives into the assessment of telemedicine's efficacy. So, about the statistics, um, encouraging findings from various healthcare settings have showcased the potential of telemedicine in enhancing patient satisfaction and expanding access to quality care. So, noteworthy reports suggest that telehealth interventions have the capacity to reduce appointment waiting times and bolster monitoring mechanisms for individuals managing chronic conditions. So, our problem statement will be while the benefits of telemedicine are evident, the field is not immune to challenges, including technological hurdles, disparities in provider training levels, and patient hesitancy towards adopting new care paradigms. It is imperative to identify and address these obstacles to ensure the successful integration of telemedicine clinical practice. So let's move on to the objectives of telemedicine management. The objective one will be examine perceptions and experiences of healthcare providers and patients regarding telemedicine. Um, an example would be conduct a survey among healthcare providers such as doctors, nurses, as well as patients who have used telemedicine services to gather their insights and feedback on the use of telemedicine for disease management. Why do we do that? Because understanding the perspectives of both healthcare providers and patients is essential in assessing the effectiveness of telemedicine on clinical management of the diseases. Healthcare providers can provide feedback on the particularity and efficacy of telemedicine tools, while patients can share their experiences with accessing care remotely and the quality of healthcare services received. The objective two will be identify challenges and barriers to implement telemedicine in clinical practice. An example would be conduct interviews with healthcare administrators and IT professionals to identify technical, regulatory, and logistical challenges associated with integrating telemedicine into existing clinical workflows. Why do we do that? Because recognizing and addressing the obstacles that hinder the successful implementation of telemedicine is crucial for realizing its full potential in clinical disease management. So, by pinpointing challenges early on, healthcare organizations can develop strategies to overcome them and ensure the seamless integration of telemedicine services into routine clinical practice. So our third objective will be explore telemedicine's potential to enhance healthcare access and delivery. An example would be analyze patient data related to access to care, appointment scheduling, and treatment adherence before and after the implementation of telemedicine to assess the impact of healthcare access and delivery. Why do we do that? Because investigating how telemedicine improves healthcare access by enabling remote consultations and reducing geographical barriers can provide valuable insights into its potential to enhance disease management. So by studying the effects of telemedicine on patient outcomes and healthcare service utilization, researchers can determine the extent to which telemedicine can enhance the overall patient experience and clinical management of the diseases. For this project, we did some researches, and the studies will be discussed offer valuable insights into how telemedicine is shaping clinical management practices and enhancing patient experience. Now let's start with Rose 2023. She conducted a study focusing on telehealth experiences among young individuals, highlighting the importance of tailored services for specific patient populations. So their findings underscored the significance of considering diverse patient needs and preferences when implementing telemedicine interventions. Now let's move on with Rokiki 2024. Explore the impact of telemedicine on women with perinatal mental health issues. This study revealed both the benefits and challenges associated with telemedicine in addressing mental health concerns during the perinatal period. The findings shed light on the potential of telemedicine to improve access to mental health services while also identifying areas that require further attention and refinement. So the other one is Campbell. There are two actually, Campbell and Goldstein 2022. They delve into the evolution of telehealth technology in pediatric speech language pathology. The research showcased the adaptability, and effectiveness of telemedicine in supporting pediatric patients with speech and language disorders. So, by discussing the technological advancements and clinical outcomes associated with telehealth interventions in this specialized field, the study highlighted the positive impact of telemedicine on pediatric healthcare delivery. So these studies collectively contribute to the growing body of evidence supporting telemedicine's integration into clinical practice. By examining diverse patient populations and healthcare settings, researchers are gaining valuable insights into benefits, challenges, and potential of telemedicine in enhancing disease management and patient care. Further research in this area is essential to inform future telemedicine initiatives and optimize healthcare delivery strategies. We talked about delivery strategies. Now let's talk about quality improvement plans. So here we are highlighting development of new patient care protocols that incorporate telehealth, implementation of staff training programs to improve telemedicine competencies, and utilization of technology such as remote monitoring devices and secure messaging platforms. Okay, so let's start with development of new patient care protocol that incorporate telehealth. So this involves creating guideline and procedures for providing care to patients through telemedicine, ensuring that healthcare providers can effectively manage diseases remotely. For example, establishing protocol for virtual consultations and remote monitoring of chronic conditions. So let's move to implementation of staff training programs to improve telemedicine uh, competencies. So healthcare professionals need training to effectively use telemedicine tools and techniques. For instance, conducting workshops to familiarize staff with telehealth platforms and teaching proper methods for using remote monitoring devices. Now, utilizing of technologies such as remote monitoring devices and secure messaging platforms. So, incorporating remote monitoring devices allow healthcare providers to track patients' vital signs and symptoms from a distance, enabling better disease management. Secure messaging platforms facilitate communication between patient and providers, making it easier to discuss symptoms, treatment plans, and follow up. So let's move on to the framework or model that will guide us to implement the different interventions that were mentioned before. And for this, we choose the Plan, Do, Study, Act PDSA model. So, what does that do? It will guide the implementation of the proposed interventions, ensuring a structured approach to quality improvement. So, let's break it down. Plan, do, study, act. What do we mean by plan? Example, health systems planning to implement telemedicine services will define specific goals, resources needed, and strategies to integrate telemedicine into existing clinical workflow. We already talked about that. And do. What does do mean? An example would be clinicals and staff will start using telemedicine platforms to conduct virtual consultations with patients, schedule follow-up appointments, and provide remote monitoring of chronic conditions. So, what does study stand for? So, study is going to be healthcare organizations will gather that data on the usage of telemedicine services, patient satisfaction, clinical outcomes, and cost effectiveness compared to traditional in person visits. And the last one is ACT. What does that mean? Um, it will be based on data analysis. Healthcare providers may adjust telemedicine protocols, refine technology platforms, enhance staff training, or expand telemedicine services to cover more specialties or population. So now that we know the interventions, we know the guide, the models, now how are we going to implement the plan? So, step for implementation includes training healthcare providers on telemedicine technologies, as we already mentioned, and it is very important that the staff is trained properly, developing protocols for healthcare consultations, engaging patients through educational resources about telemedicine. So, training, as we already said, um, we can an example would be conducting a virtual training sessions for healthcare professionals on how to use telemedicine platforms effectively, including how to conduct remote consultations and access patient information securely. Developing protocols for healthcare consultation. An example would be creating standardized procedures for conducting healthcare consultations, including guidelines for patient interactions, prescription management, and follow up care. Engaging patients through educational resources about telemedicine. A good example would be creating informational material for patients, such as brochures on or online videos to explain the benefits of telemedicine, how to schedule appointments, and how to prepare for a virtual consultation. Hosting webinars for patients to ask questions and learn more about using telemedicine for their healthcare needs. That's why we talked when we say implementation of the plan. So now, so now that we have implemented care, so how are we going to evaluate the care? So to evaluate the impact of telemedicine on clinical management of diseases, several methods can be used. So, patient satisfaction surveys. This is the first one. Conducting surveys to gather feedback from patients about their experience with telemedicines. For example, measuring satisfaction levels with the convenience of virtual consultations, ease of access to healthcare providers, and overall comfort with the telemedicine platform. That would be for the patient to tell us about that. Um, the other one would be healthcare access metrics, tracking metrics like the number of patients able to access healthcare services through telemedicine compared to traditional in person visits. For instance, monitoring the increase in remote consultations and appointments scheduled through telemedicine platforms. So the third one would be um, clinical outcomes. Analyzing clinical data to assess the impact of telemedicine on disease management can include measuring treatment adherence, because it's very important. Measuring treatment adherence rate among patients using telemedicine. Monitoring health status improvements or disease progression through remote monitoring devices. And comparing outcomes between telemedicine and traditional care. So we're always going to compare to see which one is working better. So an example for this would be a study could track the progress of diabetic patients, for example, managing their condition through telemedicine consultations versus in-person visits. I don't know if you see that. So by measuring factors such as blood sugar control, medication adherence, and patient reported outcomes, researchers can evaluate the effectiveness of telemedicine in managing diabetes and improving clinical outcomes. All right, so when we are done with all the implementation and interventions, what could be the expected result? So, based on the existing literature, studies have shown that telemedicine interventions have the potential to improve access to care, enhance patient satisfaction, and optimize disease management outcomes. For instance, research on telepsychiatry has demonstrated positive effects on mental health treatment adherence and symptom improvement in patients with various psychiatric disorders. So the results can be increase the patient engagement. Example, through telemedicine, patients can easily connect with healthcare providers via video calls or chat platforms, leading to better communication and engagement in their own healthcare. So, this accessibility can encourage patients to actively participate in managing their diseases and follow treatment plans more effectively. Another result will be reduced healthcare cost. Um, by using telemedicine services, patients can avoid unnecessary in person visits, which can result in lower healthcare costs due to reduced travel expenses and less need for physical facility. This can be particularly beneficial for patients with chronic conditions who require regular monitoring and follow ups. Another expected result would be improved health outcomes. Telemedicine allows for more frequent monitoring and timely interventions for patients, leading to better disease management and improved health outcomes. So, for example, as we mentioned earlier, diabetic patients can regularly track their blood sugar levels and receive real time feedback from healthcare providers, so resulting in better control of their condition and potentially fewer complications. In conclusion, we can say that the investigational focus on the transformative influence of telemedicine on disease management is poised to significantly impact the landscape of healthcare delivery. So, the integration of telecommunication technology into clinical practices has the potential to revolutionized patient access to medical care, particularly in the context of the COVID-19 pandemic, by exploring the multifaceted impact of telemedicine on disease management practices. This research aims to shed light on how telemedicine can enhance overall patient care experiences. So, the proposed study seeks to delve into the perceptions and experiences of healthcare providers and patients regarding telemedicine, identify challenges and barriers to its implementation in clinical practice, and explore its potential to enhance healthcare access and delivery. So, by expanding the literature review section, including studies that showcase the benefits and challenges of telemedicine in diverse healthcare settings, researchers can gain valuable insights to inform future telemedicine initiative. So, through the implementation of new patient care protocols, staff training programs, and technology utilization strategies, healthcare organizations can effectively integrate telemedicine into existing clinical workflow. So, it is essential to develop specific goals, allocate necessary resources, and establish protocols to telehealth consultations to ensure the seamless implementation of telemedicine services. So, as the study progresses, evaluating the impact of telemedicine on clinical management through patient satisfaction surveys, healthcare access metric, and clinical outcomes analysis will provide comprehensive insights into its efficacy. Anticipated results include increasing patient engagement, reduce healthcare costs, and improve health outcomes, aligning with existing literature that supports the positive effects of telemedicine interventions on disease management. So, in essence, the potential benefits of telemedicine on disease management, such as enhanced patient engagement, cost effectiveness, and improved health outcomes, are expected to catalyze positive changes in healthcare delivery and patient care experiences. So, further research in this area is vital to optimize telemedicine strategies and drive continuous improvements in clinical practices. Thank you. Hey, here are my references. I would like to apologize in advance for those who will have a hard time hearing my accent. I'm really trying, so please be patient. Thank you so much, and this is the end. Bye.